Despite significant advancements in the country's healthcare landscape, statistics show that the General Services Index is at 59%, which is slightly above average. Whereas the private sector plays a significant role in ensuring increased access to healthcare for all, there are reports of mushrooming quack practitioners undermining these efforts.
We have had people who have never had even primary education being called doctors in the community. And yet the public, because of sometimes the few failures in the government to provide all care, has resorted to going to these people because they have tended to be the first point of contact. They are available to them and they think they are helping them. The message to the public is that they are not helping them. They are actually doing them a disservice.
While launching its strategic plan for the year 2025-26, the Allied Health Professionals Council revealed that going regional with its operations is a top priority.
Many of the conditions that we are talking about, many of the divisions we are talking about, is as a result of delayed referrals from these unqualified people who are actually treating people in their small houses under trees, and everybody is being put on the IV ceftriaxone for no indication. You cannot be able to provide a service for what you have not trained in. So Council, in its strategy, is going to enforce and strengthen the inspection and regulation and the licensing of their professionals and follow up the people who are practicing are not qualified.
The chairperson, Allied Health Professionals Council, Professor John Charles Okiria, says this will go a long way in curbing quack practitioners, thereby promote access to quality health care. Speaking to members of the Allied Health Professionals Council, the newly appointed Director General Health Services at the Ministry of Health, Dr. Charles Olaro, first invited stakeholders to render him support in his new assignment before challenging the Council to tighten its grip on the registration of practitioners.
The role of the DG, yes, he definitely needs a team, and I'm looking at it, as I've told you, that it's a very strong, big workforce. So first I want to appreciate for all the congratulatory messages which I've received, but my only ask to them that let each one individually and collectively be able to contribute to the health and the well-being of the population of this country.
Dr. Olaro also hinted on plans to regulate how far or close to government health facilities a private health establishment like pharmaceuticals and clinics should set up.
It's not that we don't recognize the role private sector plays, but we need that there should be regulations. So if you license facilities which are just a few meters from the health facility, and which the workers are even health workers of that institution, then it constitutes a conflict of what? Of interest for government. So we are looking at, in the new guidelines, we will probably prescribe how far they should be able to be from what? Government facilities.
The Allied Health Professionals Council exists as a regulatory framework that ensures compliance with professional standards, ethics, and guidelines for allied health professionals. Maureen Babidie, Adia Nakuti, for UBC.
Okay, thank you.